This is a short briefing for non-nurses or midwives, for allied health, medical and other social care professionals who may be working alongside and supervising student nurses. In 2018, the NMC introduced new standards, which we are going to be implementing from this September. One set of proficiencies for all fields of nursing. There are specific skills and procedures that are required to be demonstrated. As always, we're looking at evidence-based, personal-centred approach to mental and physical care across adult mental health and child nursing. The other premises is about increase on public health and also the readiness to deliver care outside the hospital setting. Students will need to be prepared to have an increased leadership role in management delivery of care, which reflects the requirements of today's NHS. The other thing the NMC has done is recognise the interprofessional nature of practice and what other healthcare professionals can contribute to the learning process. Students are going to be expected to have a greater role in leading and managing their learning, and they will be seeking out opportunities for their learning with both nursing and also other healthcare professionals. The NMC standards are, as you see. The other thing to highlight is that students, dependent on their programme, whether they're adult, mental health or child nurses, they will be expected to gain experience in all fields of practice. So you will be meeting students in care settings that are studying the different fields of practice. So the NMC has introduced new roles, new proficiencies and new assessment processes for the students. So I'm going to talk. So the NMC have introduced new roles of supervisor, practice assessor and academic assessor. I'm focusing on the practice supervisor role because this is the role you'll be expected to undertake if you're working with our students and supervising, coaching and teaching them. The practice assessor is a named registered nurse who has been prepared for the role of practice assessor, who will oversee the practice assessment process for the students. They may not work with the students that regularly, but they will be meeting with students at key points along their placement to review the evidence of achievement that their students are gathering and to make decisions about their proficiency in order to pass each year of the programme. Students are also supported by academic assessors, which is one of the university lecturers who will be working in association with the practice assessor to determine that students are able to fulfil the requirements of their assessment and can progress onto the next year or onto the nursing midwifery register. Each placement area, students have that named academic assessor and practice assessor. The practice assessor is responsible for 3 stages of reviewing the student, and the academic assessor will monitor that stage, but they make joint decisions at the end of the year as to whether a student can progress. In between that, students work with a variety of supervisors who provide feedback and evidence for the student's achievement, which is mapped out against their assessment tool. So what are practice supervisors? So registered nurses, registered nursing associates, registered midwives, or other registered health and care, social care professionals. They must be registered with their professional regulators such as the NMC, the GMC or the HCPC. There are certain skills assessments that students undertake that will be done by people who are occupationally competent, such as phlebotomy, working in the BNSS with phlebotomists. So there is some continuity and support and supervision of students required, and that is down to the lead practice supervisor in a clinical area. But as health and social care professionals, the expectation is that you will still be serving as role models, supporting learning within your scope of practice, providing feedback to the student on their progress, and have that current knowledge and expertise. So you may be working with students for a day or a few days. What we're requiring is that you must record feedback on their progress, engaging with the practice assessor and academic assessor, which in this case would be normally through written feedback. However, if you're concerned about a student, you will know who their practice assessor is and you can raise concerns with them. So you are able to contribute to the student's learning assessment. You provide feedback on their performance, and this is done via their assessment site. There may be specific proficiencies that the students are working towards that you can oversee and sign off, but that decision is yours as a professional. If you're only working with the student for a short period of time, you do need to see them demonstrate not just competence but proficiency at the skill. So to contribute to the assessment, the student will either provide you with a feedback sheet which you can write on, and it can be uploaded to their practice assessment document, which is an ePad, or they will email you a key which you click on and you can go straight into their electronic assessment tool, their ePad, and directly enter feedback or confirm attainment of a skill. The students will be able to show you how that works, and it is entirely up to you and the student how feedback is recorded, but we are requiring it to be done. It's important that students, even though they've been assessed as proficient, need to continue to demonstrate that proficiency, and if there is any deficit in their skill, that needs to be highlighted to their practice assessor, and there needs to be some retraining. Exeter and Plymouth University, our programs are similar and slightly different, and you may meet students from either university. Exeter have a 4-year master's program. They have 2 placements each year in year 1, 3 and 4, and 3 placements in year 2. Their placements are 8 weeks long, and in year 3 and 4 they decide on the Pacific pathway, as well as going for dual registration as adult and mental health. Plymouth have a 3-year BSc, but there is a part-time program as well. There is a 4-year MSc dual registration. It can be either adult-child, adult mental health, child or mental health. We also have a 2-year accelerated Masters of Nursing in single registration as well. Our students have 2 placements a year, and our weeks are 8 to 10 week blocks. So our practice assessment consists of the following things: the normal introduction orientation, the interviews that the students are required to have with their practice assessor. Their professional values are assessed in every placement. They have to do clinical based assessments. They're called episodes of care, and it's generally coordinating care for patients or a group of patients, and they are specifically assessed on set times by their practice assessors. They also have to be assessed on medicines management in every year. We utilise service user and carer feedback as part of our evaluation of students, and then they have students have to attain clinical proficiencies as well. It all accumulates in an ongoing achievement record, which is electronic. Students are responsible for their management and autonomy of their learning. They need to be proactive in identifying their roles within the teams, and hence working with other healthcare professionals will enhance that learning and contribution that you can make to their enhanced learning, as well as providing feedback on that student and how well they do with you at specific skills and proficiencies, which can be they will identify. It's important for them to be in a lead role within that, and we expect you to encourage that when you're working with them. This is very brief. There is further information on the Nursing and Midwifery Council website. The link is here for that. Also, you may have been given an information sheet by the students, and the link is there for you. Thank you for your time and attention.